Thank you so much, everyone, for joining us. We are very, very grateful to spend some time listening and learning tonight about our topic. It's holding grief with care, chaplain support after pregnancy and infant loss. And I'm extremely grateful that we have the opportunity to learn from Reva Judas, who is the founder and director of NechamaComfort, which is the one of the foundational and innovative organizations that's been around helping Jews of all denominations as they experience, God forbid, but in encountering those moments of pregnancy and infant loss. So Reva is going to share with us a little bit um, about NechamaComfort, about the work they do and the resources they provide, which are tremendous. And then we'll have some questions, some live questions, and get a chance to learn more from her. Before she begins, I just want to acknowledge that Chaplain David Balto, who's a part of Nechama Association of Jewish Chaplains, has been working on a project specifically in this topic and this subject matter. And his work is research around creating a paper that will be able to help chaplains and other caregivers understand the family's journey and guide them to provide presence, including spiritual comfort for families facing painful situations. So I just want to highlight that Chaplain David Balto is doing research actively right now on this and expanding the kinds of resources chaplains can offer. And so the conversation that we have with Reva, we're really looking forward both to learning from her and from NechamaComfort, and also exploring in the future with David how we as Jewish chaplains can further utilize Reva's resources and begin to step into the space more fully. Um, the last thing I'll say before I turn it over to Reva and get us started. So as many of you may know, I work at a hospital in New York where there's a children's hospital, and I do spend a lot of time in um, the the pediatric setting, but especially with either with parents who are caring for NICU babies, for babies who are really struggling and ill, but also antepartum with women who are living in the hospital until they're able to give birth. And I've encountered that existential distress and need and loneliness and fear and anxiety and terror that can exist for families in those positions. And I also have mentioned this before, but I also personally have been on this journey with multiple losses. And I just want to say that what NechamaComfort offers is such a supportive balm and source of love and embrace in some of the hardest moments that we don't really have so much ritual around, and that we don't necessarily commonly talk about in our community. So what Reva and the organization have done is groundbreaking, and they've been around for a while doing this work. I am very grateful that Reva, her daughter she was one of my daughter's teacher in Gan, and Reva is someone who really just exudes love and warmth and meets you where you are. Has so much humility, and her daughter has that same vibe. So as Reva speaks to us about NechamaComfort and we begin to touch on this very sensitive topic, I just want to frame this by recognizing that there's the professional part of each of us that's coming into this conversation. And if you are like me and many, many others, there may be some personal feelings that are coming up for you as we touch on this topic. So I want to invite you to bring um, compassion and empathy to yourself, to others who are listening, and just without judgment, as we do for our patients, families, and anyone that we serve, witness and be present with a non-anxious presence to what we are living. So I am going to turn it now over to fabulous Reva, and we'll have a more of a conversation.
Thank you so much, Alissa, for inviting me here today. I'm also lucky because I've got to spend time with Alissa. She's my neighbor, not only in Teaneck. So we a few minutes we get to meet each other and speak to each other, even though we're in the same community. So Thank you so much for inviting me. This is such an important organization. And when I share my story a little bit about myself, my journey, how I came to create NechamaComfort, you'll see why I have a um, special bond with chaplains and why I think they're amazing. And I I think it's so important to bring education and awareness to many organizations, to many working parts. Chaplains is a word, definitely an important part, especially in a hospital setting where we're going to meet, where you're going to meet families who are experiencing this pregnancy infant loss. And so I'm really grateful for today. I mean, I'm going to share. I think at the end we're going to have questions or
Yes.
however you want to run it. Yeah. So
After
at
your
the end
slides, we'll have a conversation and
we'll have a
questions.
conversation and questions. But if you want to, while I'm speaking, if you have something to add, you can let me know. Um, so I'm going to begin. I'll just give you a little background about myself, so you know, like who's this woman and why is she coming on? So 38 years ago, it'll be 39 this Passover. My husband and I, we live in Teaneck, New Jersey. If anybody's familiar with Teaneck, it used to be a very out of town community, very small community. We were living here. I was for 30 years, I was a kindergarten teacher. I was teaching at the time. We were expecting our first son. And my father at the time he still is a retired rabbi, even though rabbis never retire, and a certified chaplain. And he was the rabbi in a small community, Reading, Pennsylvania, which used to be the outlet capital of the world. Now it's famous because Taylor Swift was born, fun fact, in the same hospital as my son in Reading, Pennsylvania. And the doctor said I was due in May. You could go there for Passover, no problem. And we went. And an interesting, I share different parts of the stories to different communities that I speak with. So my father was the rabbi slash chaplain slash Orthodox Jewish representative in this St. Joseph's Hospital. And Reading, Pennsylvania used to be, a lot of Jews came there in the early part of the century, late part of 1800s, 1900s, and someone had endowed money for a fresh kosher kitchen. And most of the time there weren't any kosher people, but he had to go and kosher the kitchen, one of his jobs, and make sure that the food was there. So everything was fine. In fact, at the first Seder, he said, "Oh, I think I'm going to have to take everybody out for lunch at the hospital because we don't have any Jewish patients registered as of today." Short story, I went into labor, my water broke. And in those days, once your water break, they did not let me travel back. I delivered my son on the third day of Cholamoid Passover. Strange doctor, strange hospital. For 2 hours, we thought everything was okay. He was born 5'5". I had gone into early labor because I had strep B infection, which was not known yet what that was. And my son was born 2 hours after he was born. We found out he had a very severe congenital heart defect. And the doctors did did not do the right thing, did not say the right thing, but I don't blame them because there was no guide, there was nothing to do. They said to us, "There's a Ronald McDonald House," and my son was being transferred to Hershey Medical Center. Milton Hershey, who never had children, invented chocolate and had the most wonderful state-of-the-art children's hospital. He was brought there. We were told it was midnight. We'll go in the morning. We have to figure out food, things, get rest. And he's very sick, but he's going to be okay. And it was a time, I know whoever's listening, I sound like a dinosaur. There were no cell phones, there were no computers, nothing. My mom gave them her house number. They went home and said, "Just call me." And the following morning, it was Friday. Erev Shabbat, Passover, the phone rang in my room. My family was coming in, my parents and my husband, and they said, your son is very sick. He will die very any moment. And that's how I was told. And that's what happened. We didn't get to see him again before he was buried. And my father, who had been a rabbi for about 30 years at that time, could not remember what to do. He had gotten his ordination at Yeshiva University. He called Rabbi Soloveitchik's office. And said had to be the father, the grandfather, um, the chaplain, and take care of everything. And we gave my son he gave my son a bris. His name is Pesach, not the name we were going to use. And he was buried. My mother and mother-in-law told me not to go. That was the advice. You don't go to the burial, but your husband has to go to the burial. And my in-laws are Holocaust survivors, hidden children. They both passed away the last couple of years. Um, and they had a different view of grief. My father-in-law, just looked at my husband and said, "It's going to be okay. I went through Auschwitz and survived," and that was his thing. And that was it. And the professionals told us, all the professionals, don't go for therapy. You don't need therapy. You're very depressed, but that's because your son died. And the truth of the matter was, there would be no therapists who could have even known there was no PTSD. Steven Spielberg had not reached out to Holocaust survivors yet. Nobody, it was a generation that we still whispered cancer. Um, I don't even, the roles of the chaplains and the clergy at the hospitals were still just, to give the last rites or find out, about burials. It was a very different time then, and that's what we did. And we went home back to Teaneck after a few weeks, and I was pregnant with my second child, Eliana, who's Alyssa's daughter's teacher. She was appropriately named Eliana Yaffa. God has answered us, and that was it. And my family also experienced 6 miscarriages. We have 4 living children. We have 9 grandchildren, and I would constantly look for help. I would look in the newspapers. I would see people would call me and say, um, I had a loss. My cousin in Boston had a loss. But if I see you, please do not, we're not going to talk about it. And that went on for a long time. One day, the local Lamaze teacher, who was a nurse at the hospital, told me she went for a training program called Resolve Through Sharing and was trained as a pregnancy infant loss facilitator in La Crosse, Wisconsin. And she called me up and I said, I think you're drinking because nobody cares about us. No, I don't know what you're talking about. And she said, no, really, come next month to the hospital. I'm going to have a support group and I want you to help. But in her wisdom, she knew that we still I needed to be helped. And I came, the Jewish community started to grow. She would ask me questions about Jewish law and culture, how we could be helping. And through that, I decided, okay, I'm going to go back. I'm going to be trained as a pregnancy infant loss facilitator. And the program came to New Jersey and started another support for Jewish families. Then I wanted to do more while I was teaching. I realized I had 2 people help me. We started fielding phone calls. We started a support group. And we started to do trainings because people were reaching out to us, communities and clergy, to train them. So I said, I need some more education. First, I thought about going to social work school, which I had deferred my acceptance for 7 years because I had just gotten married and then my son died. So I deferred that. And one day, the same woman, Johanna, called me up and she said, I think you should go for a chaplaincy program. I think that's what's going to help you. And she was right because I knew I needed specifically that training, how to talk to people, how to do that pastoral care, even though I grew up in a rabbinical home. And I was a kindergarten teacher, which was very different. So it was, as we say, there are no coincidences. This program came down into Hackensack Medical Center in Hackensack, New Jersey. I took training for 2 years, and then the program closed. So that's why, and it was the best thing I ever did. And I was the chaplain on call every Sunday, so I really got the knowledge that I needed. So I am grateful tonight to be here and to share my story. So many things already, and I if I repeat them, and I know that you know them, but just to say, the attachment of a couple having a baby starts when they're in early childhood. I said I taught kindergarten, and you're playing in the house. You're the mom, you're the dad. You're four moms, four dads. So already we're trying to think. We're already putting it into the classroom. You're going to play house. Then you start thinking about your future, dating, what you want your life to look like. Perfect. Okay. So we're up to the next slides now. Thank you. Okay. Keep going. Okay, perfect. So we discussed what we want in our family to look like. Do you want to have children? Do you not want to have children? And when you're looking for your partner, that is a discussion. And couples assume they expect to have children when they want, and they're going to stop when they're ready. So much of in sex education is how to prevent pregnancies. It's not talked about the many other times that you're not going to get pregnant. So really the attachment starts much earlier. And what happens when that's not what happens? Next. Here are the statistics. And they really have not changed over the years. The clients that we work with that you will probably meet in the hospital setting, this could be in an emergency room, this could be in labor and delivery. Early and late term miscarriages, people know they're pregnant, as the commercial says now, a day before they conceive. So especially if they have a fertility journey, if they're going for fertility treatments, things are really pinpointed. So early miscarriages, we work with families as early as 4 5 weeks miscarriage, through late-term miscarriage, ectopic pregnancies, chemical pregnancies, medical termination, which has become very much more common in the last 5 years. Medically, families can find out with almost certainty, 99.9%, if their baby has a genetic disorder, any type of disorder. And many rabbis who are consulted, so in the Jewish communities, in all levels of observance, as Alissa said, we work with couples, interfaith couples, through Hasidim and everybody in between. And they are sort of giving them the permission to allow them to terminate. Twin and high order birth laws, again, fertility treatments, many more people are becoming pregnant with multiples. Stillbirth, SIDS, newborn death, infant death. And we work with families up to the age of 2. We recently had a family that had experienced the sudden death of an 18-month-old. 1 in 5 couples struggles with fertility. 1 in 4 pregnancies result in a miscarriage. And 26,000 stillbirths occur every year. So even though we have a lot of advancement, the numbers are still staying the same. And the awareness, education of couples and individuals, and because they know they're pregnant sooner, they know that they're miscarrying sooner. So every community is affected. So what is the grief? We've all studied uh, the timeline of a grief journey. If you're older like me, when I first learned Psych 101, uh, there were still stages of grief and they were in order. But we know, and now we all learn that grief is not linear. So it's important to understand that as well. So even an early pregnancy test that's positive, it's still a couple may have that same journey. And as I said before, it's planning the pregnancy, finding out your pregnancy. The sonograms, the 4D sonograms, you practically really could see what the baby looks like, the fetal movements, the heartbeat, preparing for the arrival, giving birth at any stage. And that's the grief that's related to the attachment. So I know all of you deal with grief and loss and studied it, um, deal with many, many different types of deaths, trauma in your work. But how does this different from another loss? As I said, people know the gender. You know the gender at 9 weeks now. So the bonding starts so early. Many times it's unexpected. Even a couple that may know, and we've had families that unfortunately find out that the heartbeat has stopped in their baby, but they still need to carry the baby a few more weeks to deliver, or they're spotting and having cramping, and it takes time for them to get the D&C, or they try to do it naturally. Um, Even though they know, they're still hoping somewhere that there's going to be a miracle. So it's sudden, it's unexpected. Like I said, it has to be heart-wrenching medical decisions. And this grief is so profound, it will stay with people if it's not treated, if people aren't given the time to mourn and to express their feelings for a lifetime. And I think society, families, professionals still want them to get over it and to move on. And our goal at NechamaComfort is we work with the families and we help them to take this child into their lives and to move through it, to never move past it, to move through it. Um, Unlike a loss of an older person, even an older child, you don't have concrete memories and mementos. Uh, you will, and that's one of the things I would recommend, that in the hospitals that you work with, make sure there is a memory box. Today, because of cell phones, pictures are taken. We encourage families and the hospital staff, but as a chaplain, that may be your job as well, to take pictures of the baby, as long as there hadn't been a D&E or a D&C procedure, that there's actually something to take pictures of: footprints, handprints, a lock of hair. I still have my son's. It wasn't a box; it was a manila envelope, a comb, an outfit. For the Jewish families, make sure there's something um, Jewish in there. Maybe a memorial candle that they can light. Maybe a psalm with a Jewish star on it. Just check in your box to make sure that it's sensitive to that couple. People are uncomfortable talking loss, and also many of these families, about half of our families, are going through infertility treatments. Okay. This says it all. This picture resonates with many women and men. So it's a hole in your stomach and you feel empty. And I really emphasize that the woman may be carrying the baby, but it's both partners that are experiencing the loss and the grief. Okay. Regular signs that you've all, I'm sure, familiar with: physical, emotional, and social signs, and to understand that they experience pain in their own way. on their own timeline. And when you walk into a hospital room, or when you're meeting a couple maybe in a different situation, because there are two people with different personalities who have either experienced loss in their life or not, um, they may be showing different signs of their grief, and that's okay. There's no wrong or right. And this is what, people walk around, and I think this is true in anybody going through a trauma. People walk around with a smile on their face, but acknowledge that they have their own personal cloud on top of them. So I know from my chaplaincy courses, there's a lot of ritual and spiritual, and that's why the care of chaplains is absolutely wonderful and special and so needed. And a couple will be questioning their beliefs. Of course, even if they're 100% sure of the medical reasons, and really, even with stillbirths today's day and age, there's only about 50% of the time can they give a reason what happened. But they're going to ask why and why me, anger with God, and afraid of being angry at God. Was I punished? They may over focus on religious rituals, prayer, holidays, Shabbat, or rituals can be unbearable. You know, um, I know that some of the roles of the chaplain, if there is a Jewish patient, sometimes there's a Shabbat box that is offered to them, or other ritual or prayer books or things like that. And you may be looking at the couple and speaking to the couple and think, well, they are observant. I guess I'm going to accept this, or they're going to accept this, but they may not. At that moment, they may be very angry and not be able to embrace the normal rituals, and they may, again, there's no set answer. And the opposite, a couple that has not been observant, has not, and maybe learned about rituals, and you may walk into the room and offer them this, and they may be searching for an answer, and that may be helping them at that moment. Um, they may be longing for a sense of connectedness after speaking with them. They may want to connect to rituals and a community, um, or not, or distancing. We have individual case managers. We are a global organization now. We're in every organization, we're in every continent except Antarctica. And I always say, because Chabad is not yet there. But once the Jewish community is there, we will be there. And we also run weekly support groups for couples and or individuals. And what's fascinating for me to see on these support groups is, we're open to everybody, all levels of observance, and the conversations that go on. People who are not used to rituals, not used to prayer, the mikvah, anything like that. And then there are people who are, this is part of their daily lives, and the discussions, how the more practicing, they don't want to practice and embrace it, and the least practicing, they want to hear about these rituals and embrace it. um, so, and also when you're, dealing with the couple, they may want to do, in terms of the burial, they want to make sure they're doing things the right way at this moment.
I just want to add, Reva, because I know you said to jump in,
Yes, yes.
to add to that dialogue with you. I think, one of the roles that the chaplain can play is, we might be there in that moment of trauma. We might be there in that moment of shock. For a community chaplain, there may be more continuity and ongoing care. But usually, in these kinds of situations, as well as in other chaplaincy contexts, we might find ourselves there in the absolute worst moment of someone's life. And I think that you know, it might be that a chaplain is there with the patient as she's delivering the stillborn. It might be that, the chaplain is asked to come give a blessing after there's been a loss. And I think what you were just outlining that, people, we surprise ourselves. Like in those moments, are we more drawn to ritual or less? Someone who maybe thought they would always want a support group in a situation may not, and I think that that level of sort of, you know, patience with oneself and our ability to be present and non-judgmental, is such it's a privilege for us to step into that space. And so I just want to acknowledge, I think part of what you're getting at is you are, you're there in the crisis and you're also there in the ongoing support at NechamaComfort. And I think, especially for chaplains who are primarily there in the context of the crisis, being able to hold that pain, the desire for meaning, but not having any answers. It's complex and it overlaps with a lot of different kind of care that we give. And at the same time, it is unique, as you were outlining.
Yes, exactly. Exactly. I agree. Um, it's difficult to know what to do and what to say. And we're gonna talk about that. All right, next slide. Okay. And this is, as I said, this grief and journey is just like any other grief and loss. It's like working with any couple, any individual at whatever age, for whatever the reason of death. It's the same thing for miscarriage and infant loss. Okay. So this is very important. I am proud to say that, one of the things that NechamaComfort, that I personally have made it one of my passions, one of my missions to accomplish. And I think we're in a better state than we were, 5 years, 6 years ago. I was very fortunate to have my father there when my son died, because in those days, it wasn't the norm. It wasn't the norm from the Judaism and the secular world and the mental health medical staff to necessarily offer the couple the choice to hold their baby, to see their baby, to take pictures, to kiss their baby, spend time with the baby, and to give the baby a name, and to actually have a burial, the ritual of a funeral. That just didn't exist, but it lasted with people. My grandmother lived in Hartford, Connecticut, and lost a baby after 28 hours in 1942, and had no idea where the baby was buried. But when we would go to the cemetery to visit the relatives, she said till she died at 82, I wish I knew where my little girl was buried. And there are no records. So that I find is so common. And one of your roles will be really to be prepared for this. As I said, it's a very important, if you are a hospital chaplain or a community chaplain, to make sure that the hospitals have the correct information. Especially, hospitals are very, especially Catholic hospitals, very respectful of Jews. I remember when I first went into train, they don't touch the patient. They call the Jewish Burial Society. We open the window. Everything. So what I have to go in and teach them is, for a baby under 30 days, and every level of observance and every denominations of Judaism, it is agreed there is no Jewish law. And it took me a long time to understand that. I couldn't accept that. Why wasn't I given the same laws as someone else that's older? My baby lived for 12 hours. I realized maybe that God maybe had a little sympathy, understood if you were forced into those laws, into those situations, it's such a unique, difficult trauma, it would be so much harder. But that means that we can make sure that the couple understands and that the hospital's prepared. Not to hear, don't worry about it. We'll take care of it. So we want the couples to know their choices. What they choose is the right thing because it's their choice. And they should understand they can be present um, for all the rituals, for the burials, for the any funeral they may or may not want to do, and we need to give them the choices. They may choose no, we want to take care of it. In the tri-state area, New York, New Jersey, Connecticut, even Philadelphia, we work with a wonderful funeral home, Gutterman and Music Hand, and we have in Hackensack, New Jersey, Paramus, New Jersey, we have Cedar Park Cemetery. Everything is free of charge. And I work with funeral homes all over the country. So if you need any help with that, to make sure they are prepared, there may be a cost because the cemetery will have a charge, but make sure everything is available for these families and to respect their choices.
So, Reva, I just want to add to that too. I think, you and I have talked about the importance, medicine and healthcare always talks about autonomy and how, we want to be able to have choices. And sometimes it can be too much to have too many choices.
Right.
And at the same time, being able to navigate this, as you said, the family members may react differently. One person may want to be involved, one may not. Just being able to offer what is available is incredible. And I also just want to share with everyone that, I'm very grateful. Reva's going to be speaking at our hospital, just explaining some of these resources more fully. I'll say when I have told staff that, there are free resources available for burial, it is shocking. I think that is an unparalleled resource. And I think that, things along the lines like with the box you mentioned, some hospitals and some settings will have, they'll do a handprint or they'll do fingerprints or they'll have pictures or the lock of hair, like you mentioned. And again, I've seen also like Jews across denominations respond differently to that, sometimes in ways we wouldn't expect. And I think that, what happens after the hospital is not something that is often discussed with the medical team in a healthcare setting. So I think there's also something really powerful about translating as the Jewish chaplain to the staff, especially the Jewish and non-Jewish staff, what happens next? Because I think there's also a yearning from the staff to have a sense of, when they encounter loss, they don't always get a chance to process it either because they have to go to the next patient. But the fact that, you are holding their hand after NechamaComfort, I think is just a very important resource for us to know. And I encourage everyone to, not overwhelm, but certainly reach out to Reva to get this information out there.
And we'll help. We will help you. We will help you.
Yeah,
Um,
I would just want to highlight the vital importance of Reva's work in this area. I mean, this is an area where there's really little attention given to this. It was great uncertainty about what you could really ask for. And Reva's really been a pioneer in, working with a funeral home and providing the full range of services for these families, which is really terrific and an example that other communities should look towards.
Thank you. Thank you. And we are available. I know that in some communities, there will be another option that the hospitals may know of where there is a Jewish burial society that will take the babies and not let them know where the babies are buried. And that does not have to exist. We have resources and sources to discuss with anybody, any family, even the ultra Orthodox and Hasidim, that we've worked with families in those levels too, that they may be the ones that may be resistant to this because it is a change. But even in the high court in Jerusalem, it is on the books that families can know where the babies are buried, and that is very important. And definitely, I'm going to give you a few more points, but definitely you can reach out at any time, and I can help you through this to make sure you're prepared. Okay. So here are the rituals. The preparation for burial. So we at NechamaComfort, there is a preparation for adults, for older children, babies over 30 days, um, until old age, where they prepare, they do the tahara, the washing ritual. But for babies, I locally I take care of it. It's just really preparing. We have a small casket, even early miscarriages, fetal demise, where will many procedures, D&Es and D&Cs, will be performed in the hospital or the doctor's offices. We will take care of it. All the couple has to do is reach out to us at NechamaComfort, or their contact at the funeral home in where they live, and to tell the hospital we will have a Jewish burial, and everything will be taken care of. We encourage the couples again to choose, if they want, to know they can give the baby a name, and that's at any stage, even an early miscarriage. It may be a name that they wanted to use. It may be a new name. You could, if they ask you for help, we suggest maybe something that's meaningful to them. We just had a baby that was named Amuna, faith. Something maybe about the season. There was a baby named Autumn. Something about a holiday. Something with the word light in it. So there are many suggestions that we can do, and I could speak to you or the couple. If it is a boy and there is something to do with circumcision, there is a brit milah. The burial society will take care of that. Um, Parents can attend the baby burial or not. In the future, they can put up a headstone. There is no formal shiva or mourning time for a baby. That's in Jewish law, but they could have times for that. Memory objects, like I said, the memory box that will go home from the hospital. Some people create jewelry. Some people create gardens, plant seeds, plant leaves. These may be things that you may want to include in your box. They can light a candle. They can light a memorial candle. They can light a Shabbat candle. They can have the ritual of saying Kaddish, Yisker. And again, reach out to me and I can send you this information too, because as the chaplain, you may be asked these questions. Okay, next. Okay, for everything, we live in a world of fixing. We Google, we chat GPT. Everything is fixed. Some things we just can't fix. The most helpful thing to do is listen. And that's hard. We know that's hard. But really, really important. My father, as I said before, is a retired rabbi, and he lives in a nursing home now, but his mind is sharper than mine. And he was in and out of hospitals, and I would say I'd come to visit, and he'd say, the chaplain was here today, the rabbi was here today, the priest was here today, and I would say, how did it go? He said, well, he did the chaplain checklist. He said the prayer. We talked about things, and then he left. Obviously, he wasn't happy with that one. Or then he'd say to me, he came in and he looked in my eyes, and he said, what do you want to talk about? I'm here for you. And then he got a bonus point for my father that day. So that's really what it's all about. Okay, next. Okay. Again, all these things. Reach out, acknowledge the struggle, without judgment, refer to the baby by name if they do. Ask the family for preferences. Do they want visitors or not? Also check in the hospitals. Many hospitals should either have a sticker for the door, a butterfly or a leaf. I think, Alissa, you told me you have a teddy bear. You told me that?
Yeah, it's a bear at our hospital.
That tells the staff, all the staff, from the cleaning person, to the doctor, that this person had lost a baby. Don't come in and say congratulations.
Which is important because the room next door may just be celebrating a a
Right.
birth of a child who's completely healthy. And that proximity is, part of why that's such an important piece.
They really try now to let patients leave soon. If there's a C-section, they may have to stay. They may move them to a different floor. But that's important too. And for you, the chaplain, to know also what's going on. And there may be other, the husbands, wives, grandparents, siblings of the couple, other children. And we're here to help with all of them. We work with the couple is first and foremost our clients, but we have groups for grandparents, we have groups for men, and we have our case managers that will work with them as well. Okay. So this is just something, we tell the community, and what you may want to share if anybody asks you as your role, how to help them, include them in community events, ask them, but be okay if they decline. Don't push them. Acknowledge their step forward, but not overly like, wow, I haven't seen you at the gym in so long, instead of just saying, it's so nice to see you. Reach out as time passes. Make sure you have on your calendar, when are the moments that you need to reach out to them. In the beginning, at the anniversary of the birth, the anniversary of the death, 6 months. If you tell them you're going to reach out on Tuesday at 10 o'clock, unless something major happens, they are waiting for that phone call. So make sure you're there and to remember them forever on their anniversaries of everything. Okay. So if people may ask you this too, or for yourself, it's best to say something to acknowledge the loss than not to say anything at all. People have told me that they have lost friendships, relationships have ended because people never acknowledged it. Not that they ignored it because they didn't know what to say, not because they said the wrong thing. And you know what to say. I don't even have to share this with you because you know professionally. Okay. Next. Okay, like I said, there should be protocols in the hospital. Some hospitals, I have a friend who had a stillbirth. She you may see this. She has something in the Senate that's been locally in New Jersey called the Autumn Joy Act. It's on the federal level now that there should be money for stillbirth research and protocols in the hospital. What are your protocols? Not only in labor and delivery, but also in the emergency room. Have the relationship with your funeral home. In your hospital, create the memory boxes, pictures, the resources. What I always say to everybody it's important, very important to take this team approach, and you may be the one that has to do that. Okay. If they ask you about other children, always be honest. Children are great. We can't, especially nowadays, we can't hide anything from children. If, they learn right away, the first story, Noah's Ark, the world was destroyed. We sing songs about it, but that's the story. The holiday of Purim is coming up. If I would tell, I teach Hebrew school still on Sunday morning. If I would tell the class that Haman was sent away, they'd say, oh my God, don't you know the story? He was hung. So children know, they're very good, black and white. They can sense if they're not telling the truth. They should be assure the other children. Don't say that the baby was sick. Assure them that, find out how the family deals with death in the past. Have they dealt with death? A grandparent, are they in heaven? Are they with God? Share that, with them at all, and tell them to reach out to the schools, anybody, other parents and their children's friends, so they know what's going on. Okay. So if you and many chaplains have gone through losses, pregnancy loss, infant loss, going through a fertility journey. Maybe your parents did when you were growing up. It may be difficult. You may be expecting a baby. And I always tell those people in professional situations that a family's not upset that you're pregnant. If you're walking into the room, they're upset that their baby was lost. So don't apologize that you're pregnant, but also take care of yourselves physically and be gentle with yourself. Make sure you have somebody to talk to about it. You also need the support. It's not easy to deal with these losses.
I also
Okay.
want to identify that sometimes the family, especially the woman may have like postpartum issues that come up as well.
Mhm.
And I think that, you know, the as you had mentioned, sort of like sometimes there's spotting or something like just for um the understanding that this isn't something that ends quickly for everyone. Like it's not even physically or emotionally, but there can even be like depression and anxiety associated afterward. So I appreciate, you had mentioned like being patient with oneself. I think that it's an important lens through which the chaplain can also see what the family is going through and also what they don't yet know.
Talking about the hospital, hope many hospitals have gotten rid of. I hope some of them have, all of them. They come in and do the postpartum depression test to couples, which I don't understand anyway, because every new mother is tired and exhausted. But that we've really tried to encourage them and other organizations to not give the postpartum test, depression test to patients that just lost a baby. Um, and the first one provides spiritual answers, but it's difficult to do that. Let them arrive at their own answer. Okay, next. Um, what things not to say. Um, and people don't mean this, it doesn't come from a bad place. It comes from a good place, but not to say and to advise people not to say anything that starts with at least. You have children, at least you have a job, etc. It's for the best. You could always have another. At least you really didn't know your baby. It only happens to people who can handle it. It's a test from God. God only tests people he loves. You'll see the baby in heaven. I know how you feel. Even if you had the exact same situation, you don't know how that person feels. And these are actual things that have been said. Okay. Um, and I say this to every group person that I speak to, even if they see me at a Shiva house or a party. Um, when you meet somebody new, don't ask them, do you have children? Don't ask them, are you married? Don't assume. Instead, remember icebreakers as a kid. Tell me about your family. Or a common one, we always play, geography. Where did you grow up? Everybody had to grow up someplace. And then maybe you'll get the answers about their family, or maybe not. And that's okay. Okay. Remember, really, and especially for chaplains, you are the link of a chain of support. And not only are you a link, you really are taking the lead role in so many of these situations. Okay, and so we're here to help. As I said, we have individual case managers. Everything is virtual. Weekly support groups, pregnancy after loss groups, peer-to-peer support. We do many trainings in any hospital setting, communities at large, community awareness programs. We give guidance to clergy, medical and mental health staff, funeral directors. We help with logistics questions at the time of the loss, with arrangements. And I tell the family, you join the club. You never wanted to join, but you're a lifetime member. And we are here. NechamaComfort is here to support you. The wonderful, wonderful work that all of you are doing.
Thank you so
And
much, Reva. This is,
thank you.
an incredible resource. And I know you have here the phone number to call, 1-833-632-4262. Just it's a contact that I have saved in my phone to be able to give to people. I know that we're reaching the end of our time. I just want to ask if there are any questions from those who are attending now. I just want to make sure, since we said we would take some questions, very, briefly, we'll take some questions.
Reva, thanks for the opportunity to ask questions. Reva, a problem that I struggle with are with mothers who, seem to want to blame themselves. They feel really guilty about what's happened, and you can see them just going through this, prosecutorial mentality about like, maybe I did this wrong or this wrong or this wrong. What do you suggest as an approach to help people in that situation?
Again, it takes time. And not to start the sentence, well, you have nothing to feel guilty about. It's really just, what are you feeling guilty about? Some of them have a concrete answer. I fell. I shouldn't have gone to exercise. I exercised too much. I didn't take care of myself. I got a cold. I lifted my other child. Or something, it will be spiritual guilt. I didn't pray hard enough. I didn't do this. I didn't do that. Because they want a concrete answer. So it's easy to blame ourselves. It's easy to feel guilty. So it's really about saying, tell me why you're feeling guilty. Let's discuss it. And then, if it's a medical thing, they tell you to say, we've talked with your doctor. It's nothing that you could have prevented. I always tell couples at some point, we're not Catholic. We don't get punished for our actions. Nobody could tell us why God has, we don't know. But it's really to let them talk about it and they're going to come to a place that the guilt will eventually go away. But it will take time and discussion for them. And the father may feel guilty too.
Yeah. Can you say a bit more? You said you want to help the family to take the child into their lives. Can you, ground that a bit more, give us some more detail of what you do to help the
I,
family take
I
the
think
child?
by acknowledging them that it's their child, even with an early miscarriage, this is their child. The child, as we tell them, that live in your hopes and dreams. They are part of your family history. If somebody asks me how many children I have today, because of what I do, I say 4 living children. But I may not always say that. If I'm at the supermarket and I don't feel like getting into a discussion, I'll say I have 4 children. I know that I have 5 children in my heart. I also had 6 miscarriages. They're all there. So it's really writing your family story with your child in it. And for people to understand that's going to be differently. Maybe you're going to light a Shabbat candle. Maybe you're going to hang the picture up of your baby with the rest of your children. Or maybe you're going to just have that child, that sonogram picture, and keep it in the drawer in your nightstand. But this child is part of and we're giving them the permission to make this child a part of their lives. And that's why these awareness programs are so important. Getting rid of the stigma, acknowledging it, getting your community and your constituents and your people you work with to be comfortable that these are part of our lives. And also with the rituals, helping them give a name, helping them with the burial, concrete mementos that are part of their lives. I don't know if I can see it now, but what I'm showing is 3 bracelets. And I have a bracelet with all 5 of my children's names in Hebrew. And these are my grandchildren. And I never take them off. And one is because I may forget their names, and two, to know that this for me is my family legacy, is our family's legacy. And when we talk about things at celebration, if it's at a bar mitzvah of my son, who's my youngest, then we mentioned his brother when we talked about it, and that's okay.
Thank you so much, Reva. We really appreciate your wisdom and your leadership. And as David had said, you really are a trailblazer who has created this amount of support. I want to just share, I see Melissa put something in the chat. Grateful for this presentation and for this organization. Both are remarkable and very needed. We're fortunate to face you here and in the world. Practical, helpful, including for situations beyond the primary ones mentioned. Attachment begins when we are playing house as children, just one of the many notable awarenesses that were mentioned. So we are, there's an indelible impact. We really appreciate your leadership and your partnership, especially, our hope is that our chaplains can partner more with NechamaComfort, through this dialogue. And I'll just end by saying, I think one of the frames that I often give to our staff is, across loss, there is a story that's being told. There's a narrative that's coming from this moment, that's going to be told for years to come. And sometimes, when it's like an end of life situation with an adult and there's different decisions that have to be made, people are grappling with, being able to say that, they did everything they could. They thought we are people who make meaning and tell stories. And I think, giving space as you do for stories to be woven in this context, stories that otherwise are often unheard, is a tremendous gift in giving voice. And I think also, for us to be the people who often bear witness to the storytelling, an important reminder and source of awareness for how we as chaplains can provide spiritual support to those stories. So thank you for all you do.
And I thank you. And I just want you to know, I can still remember the one nurse, there was only one nurse who wrote down the name of what my son had with her phone and the name of his heart defect and her phone number. And I know what she looks like. So your role, your families will never, ever forget you. So thank you all for what you do. And please, please reach out, because I think it's such an important, we can definitely work together to help these families. And thank you for inviting me tonight.